Hello everyone, this is your student nurse J. Parenteral, and for today I'm going to perform the parenteral drug administration return demonstration. The parenteral drug administration refers to any method of administration other than the oral means. However, it most commonly associated with injecting straight into the body by passing the skin and the mucous membranes. The most common routes of the parenteral administration includes the intradermal, subcutaneous, intramuscular, and the intravenous routes. Now, I'm in performing medication administration. It is important to remember to observe and perform the 10 rights of medication administration to ensure patient safety and ensure that we give our clients most appropriate care. Now, in this video, I am going to perform the 3 skills which be divided into 3 scenarios. The first scenario will be include medication administration through the intradermal route. The second scenario will be include the medication administration through the subcutaneous route. The third scenario will include the medication administration through the intramuscular route. And now these 3 scenarios have the same preparation pace, and so I am going to perform it at once to avoid making this video unnecessarily long. So now I'm going to begin. Before we actually proceed with the actual administration of the medication to the patient, the first thing we would want to do is to check the doctor's order and the medication administration record. This is done so that I will be able to identify the drug is given to the assigned patient. We have to determine the drug names, the dosage, and the route of the administration, and the time it is to be given. Now, after doing that, we also have to check the label of the medication against the medication administration record to ensure that we are going to prepare the right medication. Now in medication administration, it is important to perform the 3 checks. We'll have to check or read the label of the medication when it's taken from the medication card. We'll have to read the label again before withdrawing the medication, and we'll have to read the label again and after withdrawing the medication. So after doing that, we have to proceed with the preparation of the equipment needed to conserve time and energy. The equipment includes the syringes. I have tuberculin syringe, the insulin syringe, and the 5cc syringe. I also have the aspirin needle and hypodermic tray and forceps, and the alcohol and cotton balls with soap with 70% alcohol and the waste receptacles over there. And I'm going to proceed now with the preparation of the medication. Now I am going to proceed with the preparation of the medication from the vial. Before I do that, I am going to perform the hand hygiene to observe appropriate infection prevention of the procedure. So if the medication still needs to be reconstituted, then the vial would contain the powdered form of the medication, and a diluent must be added into the vial. After adding the diluent, we must mix, if truly, by rubbing the vial in between the palms of your hands. So now, after doing that, I am going to prepare my syringe. I have tuberculin syringe. And then that is ideal for skin testing, intradermal injection. So I am going to open the pocket. And remember that we can only touch the barrel of and the plunger of the syringe to avoid contaminating the needle. Now, since this comes with a needle already, I am going to loosen up first so that I can connect the aspirations needle. So this is the aspiration needle. So I am going to open the aspirating needle and then connect the barrel into the aspirating needle to ensure that the connection is loose. And now I'm going to set aside the first. Then I'm going to open the converging of the vial. And then the rubber seat is the exposed, and so I am going to clean it up using the cotton ball soap with a 70% alcohol. And now, after doing that, I am going to get my syringe and uncup the syringe, and then I'm going to draw the air of the syringe, and the amount of the air is equal to the amount of the medications needed to be administered. So then I'm going to push the air into the vial, and so pushing air into the vial will prevent the vacuum from forming, and if you pull it too little air, then you will find it hard to draw the medication. If you put too much air, and then the medication might be forced into the syringe. So I'm going to invert the syringe and draw the exact amount of the medication needed. So after doing that, if you see the bubble inside the syringe, we can lightly tap the barrel to expel the air bubbles. And then I'm going to remove this aspirating needle. Okay, then throw in the aspirating needle in the waste receptacles to avoid the needle break injury. So I'm going to connect the barrel now to the appropriate size of the needle. Okay, I'm going to place the syringe with the medication into the hypodermic tray, and I'm going to write the medication ticket so that we won't forget what medication it is, this dosage, and for what is it assigned. So now I'm going to proceed to the preparation of the medication in an ampule. So this is what ampule is. This is what ampule is. So that I'm going to do first is I'm going to prepare the syringe. So I have my 5cc gauge syringe. This is the 5cc. So for my intramuscular injection. So I'm going to open the pocket, and since my syringe comes with a needle, I'm going to loosen first, then I can connect with the aspirating needle. So an aspirating needle will help to reduce the risk of having a glass inside into the medication. So I am going to connect into the syringe, into the needle, to make sure that connection isn't loose. So okay, I'm going to set it down first. So with the ampule, what would do with the flick upper steam, and the ampule is a couple of times first. So after doing that, we're going to get a gauze or a cotton ball, hold the cotton ball in between the fingers and the neck of the ampule, and then break the ampule away from you and away from the other people, just for caution. So after doing that, we're going to discard the broken neck of the ampule, set it down, then we're going to get our syringe and put the draw out medication. And now I'm going to recap the needle, and I can take the aspirating needle off. And discard the aspirating needle into the sharp container, so that we can avoid a little break, injury, and then connect the syringe into the right size needle. And then I'm going to place this into the hypodermic tray, and then I'm going to write the medication ticket now. So now I'm going to the intradermal medication administration. So intradermal administration is to introduction of a small amount of the solution into the dermis or the layer beneath the epidermis. So after preparing the medication, I'm going to head over to my patient's room. I'm going to introduce myself to my patient and verify my patient's identity and explain the procedure of the patient. Morning, ma'am. I am Jake Miraculan, your student nurse for today. And how's your day, ma'am? Okay, that's really good to hear. So that may I see your wristband, ma'am? Please just state your name and your birthday. Okay, thank you so much. Today we'll be doing penicillin test. For penicillin test is for test that if you are allergic to the medication or not. So we'll inject to your forearms if there's any allergic reaction or not. We'll be fine. Is that okay for you, ma'am? Okay, so I'm gonna close the door so that no one will disturb us in the outside. Okay, ma'am, I'm just closing the door. So we'll have the patients, so we'll have our privacy for the procedure. Okay, I'm just closing the door. I will ensure the privacy of the patient and will assist the patient to a comfortable position. Then select the site for injection. To select the injections, it should be a 3 to 4 finger width below the antecubital space and with one hand above the wrist. And we should avoid the using site of the inflamed, tender, swelling, and lesion. You also have to apply the clean gloves. So after applying the clean gloves, I will have to clean the selected injection using a cotton ball soap with a 70% alcohol, and then start a circular motion in the using the center of the rose. So after doing that, we're going to get our syringe and prepare for the injection. We have to remove the cap of the syringe, and then if there are bubbles present at the top of it. And now the barrel removed and the drop air bubbles, and then we should hold the syringe between our thumb and 4 fingers, and then hold it in the most parallel skin surface, and with the bubble needle up. We also have to stretch the skin tone. Now I am going to advance my needle into the patient's skin and then push the medication in slowly until wheel will form. And the appearance of the wheel indicates that the medication has entered the area of the intradermal tissues, and that the medication has been correctly placed in the dermis. And now we'll have to withdraw the needle in the same angle and is inserted in the minimize patient discomfort and minimize damage to the tissue. So now we are going to discard the needle. We discard the needle into the waist receptacle, and then we are going to draw a circle around the wheel, and we should use a blue or a black ball pen because a red pen will interfere with the reading. Okay, ma'am, I'm done with the. I'm done, so you are good. All right, that's good. We will have to wait the result at least 30 minutes. So I'm gonna head out, and first is that you can have some rest here while waiting. Okay, just ensure not to massage the area of the injection, and do not erase the mark that I placed around it. If you need anything, do not hesitate to call and use your call button to so that I can come back here and attend if you need us. Okay. So after doing the procedure, discards the glove used and perform aftercare and the equipment also, and proceed the documentation of the procedure. After 30 minutes, I ensure to come back the patient's room, interpret the results of the skin test. Now I'm going to perform a subcutaneous medication administration. Subcutaneous administration is the introduction of a small amount of solution in the adipose tissue beneath the skin by means of syringe needle. So after preparing the medication, head over of the patient's room and introduce yourself to the patient, verify the patient's identity, explain the procedure of the patients, and ensure patients as well. So good morning, ma'am. I am Dave Maracwan. I'll be your student nurse today. How are you feeling today, ma'am? Okay, that's good. I'm just check your wristband, and please state your name and your birthday. Alright, ma'am, so today we will be doing the administration of your insulin. Insulin will help your body control your blood and blood sugar as you have type 1 diabetes. Okay, so I'll be injecting your insulin in the subcutaneous layer of your skin. Skin over your abdomen. Will that be fine? So okay, I just close the door so that no one will from outside will disturb us while we doing the procedure. After that, assist to the patient in a comfortable position, and then select the site of your injection. Is that free for lesion, inflammation, swelling, and tenderness. So we'll have to apply the clean gloves. After doing that, we are going to clean the selected site of the using antiseptic swab, and starting with the center going outwards, and then discard the used antiseptic swab, and then we are going to prepare the syringe or for injection. So that comes the syringe. And then pinch the skin. So ma'am, can I see your abdomen area? After that, hold the syringe as if you are holding a dart. And then inject the medication of the patients. We are going to inject in the 45-degree angle. So that I'm going to release the pinch and spin support syringe and then push the medication in. So and then after doing that, I am going to remove the needle at the same angle it was inserted. Now, if bleeding occurs, apply the pressure up to the site with the dry sterile gauze until it stops, and then we have to dispose the used syringe in the dispose. Simple. Okay, ma'am, so we are done. How are you feeling? Okay, so good. Since we are done, I am going to head out now, and you can have some rest, and you can so if you need anything, use your call button there, and so that I can come back and if you need me. Okay. After doing the procedure, discard the used glove. And then perform the aftercare of the equipment, and then proceed to the documentation of the procedure. And now I'm going to proceed to the intramuscular medication administration. Intramuscular administration is the introduction of the medication deep into the muscle tissue where there is a large network of blood vessels that can be absorbed by the medication readily and quickly. So after preparing the medication, I head over to the patient's room, introduce yourself to the patient and verifies the patient, and explain the procedure to the patient and ensure the patient's privacy as well. Good morning, ma'am. I am Jake Maraclan. I'll be your student nurse for today, and I just checked your wristband, ma'am. Please state your name, your birthday, please. Alright, ma'am. So today I'll be administering you the medicine that has been prescribed by your doctor. It's a drug name with the cortisone. It is an anti-inflammatory which will help you to the tendonitis. Okay, so injecting this medication, it's your shoulder. It will be okay for you. So okay, ma'am, just I close the door so no one from outside will disturb us during our procedure. Okay. So after explaining the procedure of the patient, proceed to assisting the most comfortable position of her and select the site of for injection. Now for the intramuscular injection, we have the select site injection, that is pre-lesions, inflammations, and swelling and tenderness. we have to apply the clean gloves. So after doing that, we are going to clean the selected site. Use the antiseptic swab, starting from the center going outwards. And then discard the antiseptic swab, and then we are going to prepare our syringe injection. So we're going to get our syringe and uncap the syringe, and then uncap, and then hold the syringe using our dominant hand and holding it at a dart, and then using the Z method, we are going to advance the needle in the patient's skin. We are going to advance the needle at a 90-degree angle. And after that, doing that, we're going to go aspirate. See if there's a blood will appear on the plunger. If there is, we are going to remove the needle and discard the syringe and get a new blood. If there's no blood, then we can insert the administration of the medication steadily and slowly. So okay, now we are going to remove the needle of the patient's body at the same angle if was inserted, and then apply pressure with the injection, and then discard the syringe into the waste receptacle to avoid needle injury. Okay, ma'am, so we are done with your intramuscular injection. How you're feeling? Okay, good. So since we are done, I am going to head out now so that you can have some rest. If you need anything, so you can call me or push your button here so that I can come back here and attend your needs. Is that okay for you, ma'am? Okay, thank you. So that after doing the procedure, discard the used gloves. Perform aftercare of the equipment and proceed to the documentation of the procedure done.